Hello everyone, I'm Dr. Archit Parikh. I'm a practicing physician from Ahmedabad, Gujarat. And the topic that I'm going to discuss with you today is there a relationship between diabetes and kidney health? The simple answer to that question is yes. Diabetes is the most common cause of kidney failure worldwide. Why is it so? Friends, kidneys are remarkable organs. There are millions of tiny blood vessels within the kidneys which act as filters. So normally when the blood flows through these filters, all the essential nutrients, including proteins, are reabsorbed back, while all the waste products are excreted in the form of kidney. Meanwhile, diabetes is a state of high blood sugar, which damages these mechanisms. This high levels of blood sugar makes the kidney filters work even more harder, and as they have to filter extra amount of blood. In due course of time, due to this extra work, these filters become leaky. So the proteins which were initially reabsorbed back in the blood are now excreted in urine. Even after time elapses, the filtering mechanisms also fail. So there is accumulation of waste products in the blood, which eventually leads to kidney failure. So does every diabetic patient develop renal failure? The answer to that question is no. It depends upon various genetic factors, your blood pressure levels, as well as your blood sugar levels. So what are the symptoms of these patients? As we all know, diabetes is a silent killer. Initially, the kidney compensates and there won't be any symptoms at all. Only when the kidneys have been damaged up to 50 to 60% that the symptoms will start appearing. This will be in the form of presence of edema over your face, over your legs, and over your abdomen. There will be various non-specific features like generalized weakness, loss of appetite, decreased sleep, and difficulty in concentrating. A patient having high blood sugar is prone for recurrent urinary tract infections. So they will come in the form of increased frequency of urine, pain, itching, as well as burning while passing urine. So what does one need to do to keep their kidney function in check? Regular consultations with your physician and a nephrologist is mandatory. You should get your urine examined for the presence of protein, as presence of protein in urine is the earliest marker for the presence of diabetic kidney disease. It manifests even before the presence of any symptoms or your reports getting deranged. The blood tests which you need to order are your serum creatinine levels, your glomerular filtration rates, electrolytes like sodium and potassium, as well as your complete blood count. The glomerular filtration rate tells you about the exact functioning of the kidneys. Normally, it is around 120 ml per minute per meter square. After the age of 40, it starts decreasing by about 1 ml every year. But in a patient of diabetes having uncontrolled blood sugar, this rate of fall of GFR is a whooping 8 to 10 ml per year. This results in rapid progression to renal failure in diabetic patients. So what is the treatment which we have? First things first, there should be avoidance of any form of addiction. This includes excessive alcohol intake, smoking, as well as tobacco chewing. The next and the most important thing is strict control of your blood sugar. This can be done with the help of oral hypoglycemic agents as well as insulin. The third thing which we need to keep in mind is controlling your blood pressure levels. The target blood pressure should be maintained to 135 by 75 millimeters of mercury. This can be done with the help of angiotensin converting enzyme inhibitors like enalapril, ramipril, your angiotensin receptor blockers like losartan, telmisartan, as well as your newer calcium channel blockers like cilnidipine and benidipine. Your LDL levels should be kept below 100 milligrams per deciliter with the help of statins. If renal failure has set in, dialysis and transplantation are your only options. So summarizing everything, diabetes has a huge impact on kidney health, and keeping your blood sugar as well as your blood pressure under normal levels is of paramount importance. This is all from my side. Thank you very much.